Influenza cases are surging in our area right now. Flu season started early this year and is hitting patients hard. The most recent case numbers are alarming. The Centers for Disease Control and Prevention reports 8.7 million seasonal flu cases so far. 78,000 people were hospitalized. 4,500 people have died from the flu, and sadly that number includes 14 children. One recent survey found many Americans don't even plan to get a flu shot, but doctors hope to change that. The CDC and the American Medical Association are kicking off a flu awareness campaign, and that begins today. And Dr. Willie Underwood joins us now. He is the American Medical Association Board of Trustees Chair-elect. Doctor, good morning to you.
Good morning. Thank you for having me.
So tell us about this Get My Flu Shot campaign and who needs a flu shot this year.
Well, first of all, I'd like to say, go to our website, getmyflushot.org, getmyflushot.org. So who should get a flu shot? Anyone 6 months, years of age and older, especially those who are elderly, especially those who have comorbid diseases, because there are a greater risk of being hospitalized or dying from the flu.
So why do you think that we're seeing this reticence with the flu shot? The COVID vaccine, I get it. People have different views on that. We went through that song and dance for it seems like years. But with the flu shot here, why such a reticence to get vaccinated?
I'm not really sure, but I do know that it seems like all vaccines are being wrapped together in a conversation of being pro and against, and not thinking about influenza as something that comes up yearly and also has significant sequelae to it. As you stated, we have over 78,000 people hospitalized, over 4,500 people have died, and 14 children. We can prevent that by just getting a flu vaccine.
It just seems it's just so basic and so easy. Do you think it is kind of like this kind of, I don't know, this post-COVID type of, I just don't want to be injected with another needle, or I don't want another this, I don't want a doctor telling me I need this or I need that?
So again, I'm not really sure what it is, but what I do know that not getting it is causing significant problems to the healthcare system, people being out of work, people increasing healthcare costs unnecessarily. And that's the point that I really want us to understand. Yes, I do know that there's a whole lot of discussion out there of why people aren't getting it, but it's not too late to get it.
Yeah.
We know October would have been the best time, but as long as flu season is in, getting a vaccine can prevent these things from happening.
We've talked about some of the numbers, broken down just how deadly this flu strain is this year. What, is there a different makeup? Is this a tougher strain than we've seen in years past, in your estimation?
So the reaction is tougher. The results are definitely worse. Now, what we do know is that over the last couple of years, people had mitigating matters and actions in place, such as physical distancing, wearing a mask, not interacting in great family settings like we had in the past. And so therefore the flu, there was less exposure to the flu. Now this year, it's coming back to haunt us.
Yeah.
We have the insurgence of the flu, and getting the vaccine is probably more important than ever. The outcomes that we're having now are the worst that we've seen in over a decade, in over 10 years. This is important. Let's get it done, people. Let's save ourselves, let's save our family, and let's protect our loved ones in our community.
And let's talk about timing right now. I know you just mentioned October would have been the best time to get it, but with the holidays right around the corner once again, would you recommend now being a good time for people to get vaccinated so they have that protection as we head into the holiday season where we'll have more family gatherings, people hopping on planes, taking trips, etc.?
You said that best. Now is the time. Do not wait. Let's get it done now. Yes, October would have been best, but it's now December. We're going into the holidays. Getting the flu vaccine up until February. The flu can continue even on until May. Now is the time. Do not wait.
Doctor, with the COVID vaccine, we used to hear about its efficacy, whether it was if you've got, the Moderna or you got the Pfizer, it was 70, 80, 90. As far as the flu vaccine goes, what's the efficacy rate there? Do you know offhand?
Not the exact percentage per se, but we know that it's excellent. We know that it can prevent hospitalizations, reason to see your provider, losing work, and increase healthcare costs significantly.
Okay. Doctor, thank you so much. Really good to talk with you this morning, and the advice that you're giving, obviously the big takeaway, go get vaccinated as soon as you can. Protect yourself and, of course, protect others, which is something we have been saying and echoing for years now. Doctor, thank you.
Thank you. GetMyFluShot.org.
You got it. Dr. Willie Underwood from the American Medical Association, thank you for taking the time this morning. For more information about the Get My Flu Shot campaign, go to our website as well, cbsnewyork.com. All the information is there.